If you're watching this video, you either have an interest or you know of someone with an interest to learn more about anxiety and the physical symptoms that come with it. To help you understand it better, think back to your high school speech class. Try to imagine the classroom full of students. The moment it was your turn to step up in front of the classroom, suddenly the room fell silent. You could hear a pin drop, faces of bored kids staring back at you, and the look of your annoyingly enthusiastic speech teacher ready to scoop you up off the floor when you fall over from a nervous blackout. All these perceptions registering in your brain create a chain of symptoms in you, resulting in anxiety. In this video, you will have a better understanding about anxiety and the biological functions that occur in your body when you feel anxious. Again, put on your imagination cap back on and see yourself driving in your car, let's say to work, for example. Just a normal drive to work, no particular hurry, and you're feeling great because you got all the green lights. When suddenly, a car is rolling past the stop sign, disregarding that you're crossing the intersecting streets. Immediately you panic, and a chain of reactions are set into motion when you face an emergency like this. You immediately foresee your future, your car totaled, you being rushed to the hospital in an ambulance, and a number of catastrophic scenarios begin to play in your head. Your body ensues with a chain of physical symptoms: rapid heart rate, tightness in chest, muscles tighten, breathing is heavy and rapid, reflexes are quick, body is shaky, tunnel vision. This is your fight or flight response. Fight or flight is a normal and natural mechanism in all humans. It is meant to help us survive in times of crisis and emergencies. It is automatic, like a reflex. Sometimes it responds in protection of our bodies, or it responds in temporary muscle immobility. In some cases, it responds with running away. But not this time. No accident to live through, thanks to some quick maneuvering of vehicles from both drivers. As soon as you realize you're in the clear, you release a sigh of relief, and your physical symptoms of fight or flight slowly begin to subside. Heart slows down, breathing normalizes, muscles relax, and your awareness to your surroundings return. So what is really going on inside your body when your fight or flight response is triggered? The biological functions begin with the central nervous system, your brain. More specifically, a part of your brain called the amygdala. The amygdala are almond-shaped glands that sit deep inside the center of your brain. Its function is to activate the fight or flight response in moments of crisis or emergency. The amygdala releases adrenaline and cortisol, stress hormones, into the bloodstream. It's these two hormones that give us superhero strength to defend ourselves, or the energy we need to run for cover in a moment of crisis. These hormones activate your lungs to expand and contract in rapid breath and stimulate your heart to pump blood to extremities much faster, resulting in physical symptoms such as rapid heart rate, heavy breathing, quick reflexes, tunnel vision, dry mouth, weak limbs, tightness of throat. The fight or flight response is not all bad. It's actually a very useful survival skill. It's what has allowed mankind to survive for almost 2,000 years and evolve from Paleolithic man to who we are now. General anxiety is a very common disorder amongst the population. It accounts for approximately 19% of mental health disorders people seek treatment for. And it translates to a person who lives with anxiety simply has an active amygdala. When someone has an active amygdala, over the years, the brain develops a routine pathway known as thinking pathways. If our natural way is to respond to any given situation is to be alarmed, this will be the automatic response in most cases, resulting in anxiety. Over the years of using the same pathway, we have conditioned or trained our brains to be quick to panic, resulting in overthinking, loss of sleep, difficulty with decision-making in crisis, avoidance, paralyzing fear, chronic self-doubt, quick to anger, just to name a few. The list goes on. So where do we go from here? Look to your community for nearby counseling centers. Ask about their treatment plans, such as mindfulness therapy, self-awareness, and medication management. All these are known to be effective tools in treating anxiety. For more information on mindfulness therapy or other treatment plans, stay tuned for future videos that can teach you about all these.